Shafer here, physical therapist, here to just talk to you. I was doing a presentation to a community group the other day. I wanted to kind of share my thoughts with anybody that follows my content or any prospective patients, really anybody in the healthcare field. And the topic is kind of why managing our symptoms is not supposed to be easy. So one of the biggest approaches that I use is called the McKenzie Approach, and it's a very patient-centered, patient-oriented approach, essentially meaning that the patient the patient or whoever is in pain or dysfunction, they have to be in charge of their own health care. So that means they have to do their exercises every 2 hours or every 3 hours or whatever the case is, prescribed by whether it's a physician, physical therapist, chiropractor, whoever you're working with as a patient or somebody in pain. And I was doing this presentation just last week, and I was talking to a group of community event leaders that work on volunteering and donating funds to local communities and high school students and whatnot. And I was talking about why it's not supposed to be easy, essentially, and why it's not supposed to be easy to do your exercise or manage your symptoms. But the key there is what I see, at least in practice and physical therapy, is yeah, sure, it's not easy, but if you actually commit to, say, every 2 hours doing your exercise, say you have neck pain or back pain, and it makes you feel better, then do it every 2 hours, do it every 3 hours. And the way I related that to this group was, when you were younger, or, whenever you were in your life and you were working, say, 70, 80 hours to make ends meet or make your mortgage payment or do whatever you have to do, that wasn't easy. I mean, that was waking up every day, doing the grind, working 12, 14 hours. That's not easy at all, and not everyone does that. The same thing relates to physical therapy and healthcare in general. Is we really have to be in charge of our own healthcare. And as a patient, I hope that anybody watching this is looking for providers that are going to reassure patients or yourself, saying, hey, you can take charge of this, you don't need my help for the rest of your life. Here's some tools, here's some advice, here's some of the general symptoms about what brings you in, but ultimately you're going to be in charge of your own healthcare. And it was a quote that I use frequently, and we have it up in our clinic here, saying that patients must become active participants in their healthcare rather than patients. That was, I believe it was Dr. Vessel Vanderkook. I believe he's some sort of a neuropsychologist. He wrote this really cool book called The Body Keeps the Score. And that book is really interesting because it talks about pain science, and it really brings it back to, hey, as a patient, don't look externally. Look externally for some advice, some healthcare advice and some care, but ultimately you have to be in charge of your own care and your own, moving forward and having less pain. I think that's a really important message, really, for any walk of life, but specifically for this video and for my patients, is saying, hey, I know it's not easy. It's not easy if you're trying to be active, to wake up at 5 a.m., go to the gym or take a walk, or take your dog for a walk, or whatever the case is. But it makes you feel better in most cases. Motion is lotion. And if that's going to be what's going to cure you or what's going to make you feel better, at least manage some back pain or shoulder pain or whatever the case is, stick with it. Thanks for watching.